nobody has a bed anywhere from Galveston up to Conroe practically to be able to successfully take care of a patient that requires the isolation needs of a COVID-19 patient.
So what are you doing about it?
There's not much to do. Actually, I've been telling some folks that I've been functioning as an internist myself, taking care of some of these folks in the ER for extended periods of time. Many of my colleagues around the country, I have some elsewhere in Texas, some in Arizona, that are seeing the same sort of thing.
So an infectious disease expert talked to the Houston Chronicle, and this is a Houston-based expert who said, what's going on is absolutely horrifying. Now we have no choice. We have to take action before the weekend, which starts tomorrow, by the way. What do you see needs to be done right now in Houston, in Texas?
Well, I know and love Dr. Peter Hotez. He works with me at Baylor College of Medicine. And I think we actually needed to take action weeks ago because we see this lag of about 2-week time before people get exposed to the virus until they maybe develop cases, may become sick enough to come into the hospital. What we have to do is dial it back. We have to dial back the order that the governor put in place back on May 1st to reopen the economy, because when we did reopen the economy, cases went up, but they went up at sort of a linear rate. When he did phase 2 of the economic reopening, we started going up at an exponential rate, and that's where we find ourselves now, where it gets really, really scary. We need the people of the public to wear a mask. They need to remain physically distant from one another, and we need our elected officials to listen to healthcare workers on the front lines of this so that they can implement the measures that are necessary to get us safely through this pandemic. The problem is, in April, Governor Abbott said, we've demonstrated that we can corral the coronavirus. And if you look at the numbers, we were able to do that. A couple days ago, he said, COVID-19 is now spreading at an unacceptable rate in Texas, and it must be corralled. Can you guess what the difference is? Well, in May, the governor let the horse out of the barn, and that's where we are now.
So, Dr. Redlener, I don't know about you, but it feels like you and I had these very same conversations, 2.5 months ago. The warnings were out there. In many cases, they were ignored. And the Washington Post is reporting that behind closed doors, Vice President Mike Pence is trying to assure Republican senators that this is under control. Quote, multiple senators said Pence pointed to positive indicators, including the fact that while infections are rising, the mortality rate is not. I want to remind viewers something Dr. Fauci said this week.
Deaths always lag considerably behind cases. So you're seeing more cases now while the deaths are going down. The concern is if those cases then infect people who wind up getting sick and go to the hospital, it is conceivable you may see the deaths going up.
So give us your take on where we are right now, particularly in the South and the West, and the reality versus some of the messaging coming out of the White House.
Yeah, Chris. So this has been absolutely extraordinary. You know, we've for a long time talked about the president and the administration ignoring the advice of not only his own public health officials, but public health officials all over the United States. Dr. Dark's report from Houston is terrifying. And I think what we're seeing is an extraordinary level of irresponsibility on top of ignorance and some delusional thinking that's coming out of the Trump-Pence team. And they seem to be oblivious to the messages that they're delivering to the public when they hold a large rally, for example, like they did in Tulsa last week, and people are not wearing masks and people are crowded together. It's just crazy. And I think it's also worth noting that when we start filling up the hospitals with COVID patients, that also puts pressure on the care of patients without COVID. So if the ER is filled with COVID patients and you go in there with chest pain, the hospital personnel are going to be unable to give full attention to what you're coming in with, Chris. So it's a very complicated problem. But I'm failing to understand why the White House seems oblivious to the facts that we're seeing on the ground. It's just extraordinary and really inexplicable, other than starkest partisan politics coming into what's a public health crisis. It's really astounding, Chris.
You know, and we don't have these briefings anymore that we saw every day. And a lot of people say, well, the president dominated them anyway. But the coronavirus task force met yesterday. And after that meeting, the White House released a readout, and it said this. The task force discussed that 38 states have decreasing or stable case counts and that only 3% of all counties have a sharp increase in case counts. I mean, we should note that these figures do not align with ours. The White House also said task force doctors agree that cases today are far different than cases in April because of the testing and demographic data we're getting. Do you buy that that's the position of Dr. Fauci and other medical experts on that task force?
Dr. Fauci could not have been more clear about what the reality is. And you have to speak to any doctor on the front lines of these places where we're seeing surges, including the health officials in ostensibly Republican states. I think it's absolute nonsense what the White House is putting out right now. And I think it's, you know, they're operating in some sort of delusional, surreal state here that has nothing to do with facts or reality. You know, you mentioned the fact that they're not having the briefings, daily briefings anymore. In some ways, I'm really glad. I mean, those are the briefings where the president was promoting drugs for treating COVID that were not correct. They were actually causing deaths and harming people, and where he talked about doing things like using bleach and inserted UV lights in the body, et cetera. There was so much nonsense in those briefings that in some ways I'm pretty glad we're not having them. What we should be having is daily briefings from Fauci, the head of the CDC, Dr. Redfield, and Admiral Giroir, the members of that task force. We don't need to hear from the White House. We're not getting truth. We're not getting appropriate responses, and we're getting a disconnect from reality that is really pretty shocking, Chris.
Thank you for checking out our YouTube channel. Why don't you subscribe? It's really easy. Just click on that button down there. And for more news from MSNBC, click on any of these videos here for the latest interviews and highlights. You can get more videos from MSNBC with our newsletters. Head over to msnbc.com/newsletters to sign up.